Thank you. Yeah, obviously if you have to just try and slip out as quietly as you can. Thank you for letting me know. All right, good morning. We're ready to give birth today. Right. I'm like, oh, it's a nice picture to have up like as you walk in, right? We'll keep going today. We'll finish up this chapter. We'll talk a little bit about the stages of childbirth and the process of labor. I'm going to show you a little excerpt from following up with that clip I showed you from what to expect when expecting. I'll show you kind of the end process, as a bunch of them are giving birth or adopting, right? There's kind of a couple of different ways that they go through this process. And then we'll get into, depending on time, we might start chapter 15 a little bit. On Monday, we have a guest speaker coming in. Like I told you, the health center's coming in to talk. So they will be here on Monday to cover the bulk of chapter 15 on STIs. So you can look forward to or dread that appropriately, maybe a little bit of both, but we will keep going with this today. I feel like I had another thought, but it left me, and maybe it'll come back. Are there any lingering like thoughts or questions, anything from last time before we keep going where we left off? Okay, so we've gone through the whole process of pregnancy, right? We talked about how that baby is developing, the fetus is growing and developing all the way through. Now, when you hit roughly like 37, 38 weeks on average, we start to go into labor, right? And that's what we'll talk about today. Very few babies are born on their due date. It's very, very uncommon to have a baby born on their due date, but within like a week in either direction is relatively common, unless we have that rare case that we were talking about where it's like over a year, which is very, very, very uncommon. So as women near the end of pregnancy, they started having what are called like practice contractions or Braxton Hicks contractions. And these are like little intermittent contractions of the uterus as it gears up toward labor and childbirth. Now, Braxton Hicks contractions don't tend to be super painful, but they oftentimes can stop people in their tracks, right? And they get more and more intense as you get closer to your due date and closer to going into labor. And there's kind of an informal rule that most people tend to follow when it comes to when do I go to the hospital? Like, when do I go? When is this actually happening, right? Because many people will end up going to like the labor and delivery department at a hospital multiple times before they're actually going for real. Now, it's not something that we tend to talk about a lot. With our first, we went to labor and delivery 4 times before it was like the actual time, to the point where like when we went on the real day, I was like, yeah, it's not happening today. I forgot my snacks. I was really upset. I like sent somebody back to get them for me. My in-laws was like, go get me my snacks. I'm gonna be here a while. But oftentimes people will have contractions and they think they're in labor. So they go to the hospital will check and see where they're at, monitor them for a while, and then oftentimes send you home, right? And that happens pretty frequently. But the rule that we tend to follow is called the 5-1-1 rule. So when somebody meets the criteria for this, it tends to mean that you need to go to the hospital because you're in active labor. Okay, so what the 5-1-1 stands for is your contractions are 5 minutes apart. So the contractions that you're having are 5 minutes apart, lasting 1 minute each. 1 minute each. Right, and this happens for an hour. So when a woman is having contractions that are 5 minutes apart, lasting for 1 minute each, and that whole process is occurring over the course of at least an hour, they meet the 511 rule criteria, they need to go to the hospital because you're in active labor. Yeah.
So like, I heard that like, those feel like cramps, but like, 100 times worse. So we're feeling that like every 5 minutes.
Or less, yeah. Or like more frequently, it could even be. Labor is not a pleasant process, right? Like it definitely is painful, but like we were talking about last time, you were here, but we were talking about last time, most people tend to forget the whole process, right? And they're willing to do it again or multiple times, but yeah, it hurts, right? Labor, it's like a very intense cramp. Now for some, it's not too bad, but for others, it can require like some kind of medication to deal with the pain. My partner, this sums up my partner in like one story. My partner was in active labor and she's like, let's clean the house so that it's clean when we come home. I'm like, you are literally in active labor. And she's like, I know, it'll take us an hour and then we'll go to the hospital. I'm like, are you serious right now? Like, I'm like, wasn't even in my right mind. And she's like, let's clean the house, right? That sums up my wife for you. And so you can still function, obviously, during it. It's just, it will oftentimes stop you. And you might need a second, and then you're fine for several minutes or maybe even hours, and then you have another one. So yes, it does tend to be painful, but we clean the house in the middle of her labor, right? Yeah, for sure. I tell that story often because I think it literally sums her up to the T, right? Like, I want my house to be clean when we go home, so let's clean it. You're in labor. Okay, whatever. Yeah. You could, but morphine goes directly to the baby, right? So if you take morphine, it can put the baby at risk as well. If you snorted a leaf, no, that would probably be really bad, right? So you want to, usually people manage this on their own. And when they get to the hospital, they might get like an epidural or a spinal, but you're not really encouraged to take anything for it because everything you take, especially at this point, goes directly to that baby, who's like obviously very close to being born at this point. And you probably won't. Most people don't tear or have episiotomies, and it's not actually the vagina that will tear, it's the perineum. Yeah, right. And it's not likely, but you have the option of having a C-section. It's definitely an option that you have. So when you meet this rule, 511, right? 5 minutes apart, 1 minute each for an hour, you go to the hospital. There's one exception to this, and that is if your water breaks. If your water breaks, or what we call our bag of waters, that amniotic fluid, if that breaks, you need to go to the hospital immediately. You have less than 24 hours to deliver that baby because they no longer have fluid surrounding them to breathe through. So if your water breaks, you have to go right away. Or if you fit this criteria, then you would go to the hospital. So you go through 3 stages of labor. And in the first stage, what's happening is your cervix is starting to dilate. Remember, the cervix is the part that's like right at the back of the vaginal canal. It closes off during pregnancy, and that allows all that fluid to stay in there and hold the environment steady for that baby. So your cervix starts to slowly open up and dilate. That's what the contractions are, right? The contractions are your body like slowly opening that over the course of hours. Now, for a first pregnancy, this can last on average 10 to 16 hours. Okay. You're like, nope. The looks on your faces back there. You're like, nope, no children for me. It's good that I didn't have our kids. I have like no pain tolerance. I would just be done, right? But when the stage is happening, right, 10 to 16 hours, it's not constant, but it's happening slowly, going from being fully closed to fully dilated. Now, as a side note, what does that look like in terms of like perspective? 1 centimeter, so they talk about dilation in centimeters, right? Just for perspective, 1 centimeter is a Cheerio, 2, a lifesaver, 3, a banana, 4, a little Nilla wafer, an Oreo, 5 centimeters, a pineapple. I know my food, right? A tomato, and then an English muffin, and then like a full bagel would be like 10 centimeters, right? So as you're dilating, here's just like a point of reference for you. So we completely closed off to eventually by the end being open a full 10 centimeters, which is about the size of a typical bagel, right? You're taking pictures of the food. Knock yourself out, right? Of the pineapple, right? Of the pineapple, right? Apparently I'm wanting pineapple. I don't know. So let me go back 1 slide here. What was that? No, yeah, right. Bring something. Now, when you're in the process of this, you probably aren't wanting to eat necessarily. So you always want, we'll see, right? Yeah. Mhm.
But so she was hungry. She wanted to really eat
Yeah.
actually. And they kept telling her no.
Mhm.
And like she kept like trying to sneak it.
Yeah, right, like taking food.
Yeah.
And it depends on the circumstances, right? If you're having like a typical labor, you can still eat during labor. And some people want to, some people don't. But if they've induced labor or you had a epidural or a spinal, they might not let you eat, right? And so for our children, both times they were induced. So what that meant is they give you a medication called Pitocin. You don't need to know that. And what that does is it induces labor, right? So it starts the contractions happening. And then they had to give my partner something called magnesium because her blood pressure was so high. So she couldn't eat, she couldn't get up, and it took 2 days of labor before our children were eventually C-sectioned to be born. So I went into having children very sleep deprived. 2 days, it was like they could come at any minute. By the time they were born, I hadn't slept in 2 days. That was not a good place to start, right? Because babies don't sleep a whole lot. But this can be something that usually it only lasts like 10 to 16 hours. For a second pregnancy or later, this can be very fast, right? This can be a matter of like an hour to 2 hours of like, or it's happening now, right? People can have this happen very quickly the second time. Yeah.
I think my aunt, when she was kids, and
Yeah.
she didn't be able to like eat food when she got to the hospital. I believe her water broke, and then she went to the In-N-Out drive-thru. She wanted it.
Hardcore. I like that, right? I like that.
Like, they will-
Yeah. It stretches, right? So remember, we talked about the muscular canal, like the vaginal canal, is normally about 4 inches in length. And so it starts to stretch and thin a little bit as well in preparation, but it's mainly the cervix that's opening. And that's why your water breaks. Oftentimes people's water breaks during labor, right? Because what happens is as this opens, right, your water comes out, right? And so your water might not break until you're in the middle of labor. In movies, it breaks and people go to the hospital. That's not the norm. It traditionally breaks during labor. You might not even notice it because you're pushing or you're under pain of contractions. But it's very common to happen like as you're maybe like 2, 3, 4 centimeters dilated, that water will come out. Yeah.
And you're like there, are you supposed to just not even do anything, like no pushing or anything, you're just sitting there?
You don't push until you're fully dilated. Okay, so oftentimes during this 10 to 16 hour process, people are, if you're in like labor and delivery, you're in the hospital, you might be doing like breathing to manage the contractions. Some people walk. Very common for people to walk the hospital during this time as like their body is just going through this process. You're just kind of waiting, to be honest. You don't actively push until you're in the second stage. So not until you're fully dilated at 10 centimeters. So nurses come in periodically, they check to see how dilated you are. Nope, yeah, you just wait, right? So, and 10 to 16 hours, it sounds like a really long time, but it really isn't. It goes pretty quickly for most people. And again, people are walking. I was at the hospital last week and Kaiser plays a song every time babies are born. They play like the little Brahms lullaby. And I heard one and then I heard another right after it. I was like, oh, twins, right? Like when ours were born. But you see people wandering the hospital. It's pretty common, like people who are pregnant and in labor, just trying to walk to keep that process going. Was there another hand? I thought I saw. Yeah.
But when was like that early labor process when you would like stay at home and when would be the appropriate time to go to?
Sure. So let's say you're having contractions, they're painful. And so you go to the hospital thinking like, oh, I'm in labor. If they're not frequent enough, or if there's no change in like cervical dilation, they'll send you home. And that happens, like I said, that happens a lot. So they might send you home and you might have to go back an hour later. Like, I mean, it literally happens that way sometimes for people, or it could be days or weeks later. So oftentimes people think they're in labor on the first pregnancy and they might not quite be there yet. And again, much faster for subsequent ones. Yeah.
Usually it's faster with the other ones.
Yeah.
Fourth kid, my brother, she did not want to give birth. She was just like, I'm not ready. I'm not ready.
Mhm.
Like he was a couple weeks early. He's big.
Yeah.
He's almost- But like she was in labor for over a day. because she didn't want to go.
Yeah, yeah. I mean, and sometimes our bodies go very slowly during this process. Sometimes it's very quick. Sometimes you have to get induced, sometimes not. It's kind of all over the place, which is why those prepared childbirth classes are so helpful. So you understand what's going on and what the options are. And obviously the doctors are pretty good at telling you what's going on, but there's just an incredible range of outcomes. And usually during this stage of labor, this is when you would get an epidural if you wanted one, or get a spinal if you needed one. Traditionally, they don't allow partners in for that, which I was very unhappy about. Like I stood outside, like pacing, because they wouldn't let me in. I was very mad about that. I wanted to like take the doctor out. But because they're doing a procedure, and so they don't want like someone else in there who's going to maybe overreact or faint. Yeah, a lot of people faint, partners faint during these procedures. And then they get punched by their wives later. No, I don't. But it's very common for people to faint as they watch C-sections or people pushing or getting epidurals. So they don't want people in there to be a liability. Mhm. So once you're fully dilated, you start pushing, right? And that's the second stage of labor. When you're actively in labor, actively pushing, this tends to last like 30 minutes to 2 hours. 2 hours is usually the cutoff. If a baby hasn't come out of the vaginal canal after 2 hours, then typically you might have to explore like a C-section. Okay, because what's happening is it's a lot of strain on that woman, puts her blood pressure really high from the pushing and the pain. And then also the baby is kind of oftentimes stuck in that spot where it's kind of between the uterus and like coming out, right? And so there's not as much oxygen, it can be dangerous. So if a baby hasn't actively come out after 2 hours, you might have to have a C-section, right? And that's something that sometimes happens. The term crowning, if you've ever heard that, that's when you can see a baby's head, right? And so there's usually a point where you can see it in this last image here, where the cervix is fully dilated. You might be able to see the head of the baby when you're looking up the vaginal canal, or they're checking to see how dilated you are. They can sometimes tell you the hair color and everything because you can already see that. But that's the term for when that baby is kind of starting to come out, but not quite out yet. There's a third stage of labor. So after the baby is delivered, there's actually one more stage, and almost everyone, it's so like non-significant at this point, right? Because you've just given birth to a baby, but you pass the placenta and the afterbirth in the third phase. It's usually one last push and like all of that comes out. Interesting cultural beliefs around the placenta. Some cultures will save it. Some cultures will consume it. It's typically discarded by the hospital as like waste. But there are like several cultures that believe in cooking and consuming the placenta as like a source of good luck and health. And there are also like newer trends of saving and freezing the placenta for stem cell research and for maybe use later in life in some medical way. So interesting in this third stage, it's usually kind of very uneventful, but people do sometimes either save or use or keep the placenta for different reasons. Most of the time, as I said, it's discarded. Yeah.
They do the same thing with like your umbilical cord. Isn't there special cells in there?
Yeah. So the placenta and umbilical cord being kind of connected to each other. And sometimes they'll have someone like cut the umbilical cord as like a symbolic gesture. Usually it's done by the physician. But yeah, the umbilical cord and placenta kind of very similar. They might keep that as well. Right. There's interesting stem cell research stuff coming out of like that part, right? That it might come in handy somehow later in life, right? It's interesting. It's starting to become more popular to freeze it and save it afterward. Not like in your freezer at home, but like in like a cryo bank somewhere. Yeah.
So what does the placenta have? Like after you get rid of it, like what's in it? Is it beneficial? Is there like DNA from the child?
Yeah.
Still?
Yeah, so it's thought that there might be some cells in it that help with certain diseases later in life. We're really in like the beginning stages of knowing what to do with that, but there is some indication that it might have like protective qualities later, that it could be used like medicinally later. But yeah, we're really, really early in that. But people are starting to freeze them on the off chance that it might be helpful later on in life somehow. Right? Yeah. 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 Mhm.
So most of them are not just before they were, but now we realize.
Mhm.
There's this.
Yeah.
it Says, along with the scenes that are made and like skills and stuff,
Mhm.
they get it from that.
Yeah, they usually give you an option, right? So when you go into the hospital, when you're admitted, you fill out a bunch of paperwork or somebody fills it out for you if you're in too much, you're not in a state to be able to do that. Or you can fill it out ahead of time and you decide what you want to do with that. And they oftentimes will ask you again after you've given birth, just as a double checking of what you would like to do. Yeah, so it's pretty common that you have a discussion ahead of time about what you want to do with that. Yeah. So most people like it's popular to keep them and freeze them. Yeah, you have that choice. Yeah. I have a video that I want to play for you. And I played this that clip of it last time for you, that what to expect when expecting. The one who was up there experiencing all the physical symptoms that she'd like to forget. And so in this movie, what I love is they have 4 different women who are on the journey to having a baby. One of them was the one that you watched, Wendy, right, who has just an absolutely awful time through her pregnancy with everything. There's another woman who's carrying twins who like basically sneezes and gives birth, like, which isn't overly accurate. And then there's another one as well who is adopting. So a couple of different women here going through this process. And one of them has complications, right? Just to kind of give you a heads up, she's fine in the end, but she does have some complications during the procedure, just to give you that trigger warning. But I want to show you this process of these women going through labor and delivery. And then they talk a little bit about like pain management and epidurals and things like that as well. So let me pause this. Okay. All right, so you get to see all of them kind of go through the end of that process. As a side note, it makes me laugh every time they're holding the twins and they're both sleeping. I'm like, that doesn't happen. They don't both sleep at the same time. No, I literally have never been so sleep deprived in my life as after our twins were born. I once came in and started teaching the wrong class. No one said anything for like 20 minutes. I think everyone felt bad for me. I started teaching this class and it was my abnormal psych class. I was like, I didn't even know where I was that day. I don't think I hadn't slept in like 3 weeks. But yeah, it was crazy. Twins, because they come out on different schedules. It takes like 6 months for them to get synced. And then they finally sleep at the same time, but it takes a little bit. So again, sorry, if I go back here. So we don't need to see the food again. Maybe you do, I don't know. So you go through this whole stage, right? And you see them all going through labor. They're coming in. One of them has their water break, only one of them. Again, that's not the most common. And then actively pushing the one woman, like the baby isn't coming, right? So they had to do a C-section. And then they didn't show the 3rd stage, but you just kind of get to see that whole process. Kind of a cool movie following the whole journey of pregnancy. It's based on a book, which is one of the most common books that people read as they're pregnant, called What to Expect when Expecting. And so again, the most traditional method would be a vaginal birth, but C-sections are actually quite common. Right, and we've been talking about them a bunch, but C-sections are traditionally done when either the baby's in the wrong position, they're not advancing properly during labor, there are multiples, or maybe the baby's too big, right? Or there's some health concerns for the mother. There's a lot of reasons they might do a C-section. And typically what you see with that is it might be scheduled in advance, right? If your insurance allows that, or it would be scheduled as you're going through labor and then like things don't progress. And so they put you in an operating room, and then your partner can usually come in scrubs, like he was in scrubs. And then it's a procedure where they cut through multiple layers to pull the baby out after like putting an incision in the abdomen. The woman is typically awake during this, but they've received a spinal or an epidural. And so in theory, they shouldn't feel anything. That's not always the case. But in theory, you shouldn't feel anything at all. Some of you during that are like, I'm never having children, watching you watch them scream, like, no, not happening. But then they're happy afterward, right? Again, like there tends to be a short-term memory thing with that. But going through and removing the baby, as you can see in the image there, or babies, if there's more than one, very again, very common procedure. It's practiced a lot. And the only difference in recovery is that traditionally that woman then has to stay in the hospital an extra day. Because it can take about 24 hours before they're able to stand and get up. Just as everything wears off. But Wendy got an epidural. And so because she got an epidural, the baby didn't advance, right? And again, as we talked about last time, when you use more pain management methods, you become more likely to have a C-section. Right? C-sections, it's wild. Again, you go in an operating room and then they surgically remove the baby and then oftentimes wheel the mother and the baby out. And it only takes maybe 30 minutes or so. It's a relatively short procedure. Yeah. It's more common, right? So sometimes they call it a VBAC, right? When if a woman wants to have a vaginal birth, and the family want to go back to a vaginal birth, that I don't really remember that, right? But it's more common when someone has had a C-section, they typically will have it the second time.
Is it by choice or just by being?
It's the scar tissue that's there can sometimes get in the way and make it complicated. Sometimes people will try for a vaginal birth and then maybe end up with a C-section. It's not impossible, but it's more common if you've had it once. They just have it the second. And they usually go right over the same scar.
Yeah.
You know, and so you do have a scar for life on your abdomen, but it's more common to have C-section both times.
Okay.
Yeah,
Yeah.
not impossible, but more common. Yeah,
How common, how often are complications?
they're not bad at all. Like the complications most of the time are things like bleeding, or people having issues with like feeling pain during. So I don't want to scare you, right? Like, sorry, I feel like you're already scared, right? My partner, when we had our twins, her epidural didn't work. And it was too late to do anything about it. No, so she's like the toughest person that I know. Like if that had been me, I would have not. Like it's fine, whatever. But she felt everything when they pulled them out, like literally screaming and threw up.
No,
And it was, I wanted to punch the dog. I've never wanted to like kill someone so bad. You can't. They tried to increase. They tried to increase the amount of like numbing, but it was too late. So there was nothing they could do. No, so they gave her in here, they gave her morphine and it started to kick in later.
Like after.
Yeah, but I mean, it was pretty awful because we went through the first one and she had an epidural and everything was fine, didn't feel anything. It was like very typical. And then in the second one, they gave her a spinal and for some reason it just didn't work. And that is pretty rare. It doesn't happen often. Again, I'm not trying to scare you, but that's one of the more common complications is that maybe the pain management methods don't work. There's too much bleeding. The mother's heart rate can drop, but it's a very safe procedure for the most part. It didn't used to be. If you go back 100 years, people died all the time in procedures because we didn't have the knowledge we have now. But they're relatively common and safe. I mean, honestly, those are probably the most common issues. Yeah.
So it's like when they like open their teeth, right? Like that,
Yeah.
when they work on your teeth, they're like numbing your teeth, so you
Yeah.
don't feel anything.
Right, but some people do,
Like,
right?
well, I was just like, I feel like the your gums or something, like I can feel
Yeah.
it big, but I don't feel pain.
Right.
So it's like that.
Yeah, it's like you feel pressure, but not pain. It's what it's supposed to be like. And again, it's very rare that doesn't go as expected, but I mean, it hurt. It was again, I was screaming at the anesthesiologist. I was like, do something. I'm like, oh, you're next. Oh, I wanted to say that. Yeah.
Like, you know, she got pain.
Yeah.
They can also be like super numb or, cause I mean, you know, I know from my aunt, like I grew up with her, she was like, oh, my biggest fear is like to not be able to like swallow. Like, and that ended up happening to her, of course.
Yeah.
And she like was there, and they had to like lose these sections, she was trying to version. And it was like, and she like legit would like not talk, like not doing.
And again, really uncommon. But sometimes they can go too far, do too much. I mean, it's usually done at a point where it's like your chest and down, right? And so it'd be pretty uncommon to affect anything higher. But it's not unheard of, right? And it could also be some of it psychologically feeling into it. If that's your biggest fear, it may be more likely to happen, right? But spinals and epidurals can also have long-term things like headaches, For some people are back pain, but for the most part, things go normally. I mean, like there's always complications to anything, right? Any procedure has its ups and downs and risks. Most of these things go pretty smoothly, but it obviously can go the other way. Yeah.
The cervix is so close.
Mhm.
that-
Yeah.
Does it go back to being?
Mhm. Yeah, so it takes some time, but it does slowly go back. And so does the uterus, right? Because the uterus is obviously stretched quite a bit to accommodate for a baby. And so over the coming like weeks, it starts to slowly go back and back and back and back. Yeah, yeah, hips can widen, like your body changes a little bit during pregnancy, and it all goes back to like pre-pregnancy levels. Though it can take like 6 to 8 weeks sometimes for that to happen, just slowly. And people tend to lose a lot of that weight, right? She's like, can you help me lose 8 pounds, right? Like oftentimes a lot of the weight that people gain is water weight, related to all that fluid that's surrounding the baby. And so when you give birth, you lose the like 8 to 10 pounds that is the baby plus all the water. And so sometimes people end up pretty close to where they were before, right after they give birth. Other times, you gain, 30, 40, 50 pounds and you have some time to try and get that off. Yeah.
My friend, her little sister had like a really big head when she was born. And the mom basically, it took so long for her cervix and the vagina to kind of contract to this normal level that her uterus ended up like falling out of her vagina. And she's like over years and years, she's had to have all these surgeries to kind of.
It's like pelvic floor surgery kind of thing. Yeah.
Uterus affecting. That whole birth affecting stuff like in her back and the arms and the lower.
Yeah.
She's
Right. And again, it's always, we always hear the worst case scenarios, right? Like that's what you're going to hear. It's like anytime you go to read a review of anything, you're going to hear the best and the worst. Like there's very rarely the neutral ones in the middle. And so there are obviously things that can go wrong. People do die during childbirth. Babies don't make it during childbirth. I can't remember if I told you or not about my partner's sister, had a stillbirth. Her baby was strangled by the umbilical cord and didn't survive the day that the baby was supposed to be born. Right. And so these things happen. It's sad. They happen, but most of the time things go normally. Right. But this little baby, he was 12 pounds, really big baby. Like my partner's sister gives birth to big babies. They're all like 13, 12 and 11, like big babies. And so like the day before she was supposed to have a scheduled C-section, he stopped moving. She didn't notice him moving anymore. And he had strangled himself with the umbilical cord. That happens. It's rare, but it happens. Just like, cases where the uterus, it doesn't go back to normal, or people don't feel the pain medications, or there are complications with the baby or the mother, but they're not common like they used to be. Right. So, I mean, it's okay to have some fear of it, but don't be terrified of this. Most of the time, like 99% of the time, things go as expected and normal. You can also do some other alternatives. This one's kind of gained some popularity, water birthing, right? This isn't like you go in like some random hot tub, right? Or like bottled water. This is a very sterile environment that's done. Some hospitals offer it. Some hospitals also now are getting in the habit of doing like a gradual birth where they dim the lights and they try and recreate like a very calm environment. So the baby comes out into something more mellow rather than bright lights. Hypnobirthing is another one where people, instead of medications, learn to hypnotize themselves to manage pain. I mean, people can do this with dental procedures and all sorts of things. And I mean, I'm not willing to give it a shot, but a lot of people love to do this. Hypnosis, water births, C-sections, very common. But the other ones are kind of some alternative methods that people might explore. You'll go here and then back. Yeah. The idea is that the baby has grown for 9 months in water. And so they come out into water. So the thought is that it's more of a nice transition for the baby. So they go from like a warm, wet environment and they come out into water. It's not thought to be as harsh. Now, it's not like we can ask the baby what their experience was, right? But I mean, that's the idea behind it, right? So it's just thought to be a kinder transition into the world. I mean, there are risks with it too, right? But it is like a relatively common procedure. The things look a little bit like this. There's a spot for the woman to hold on to. They're doing everything the same, just in water. Yeah.
Because if you're in water,
Yeah. Yeah, right. So there are other like complications to that. So it's easier for the baby in that transition, but sometimes it's harder to monitor medically.
Like someone feels.
No, right? Go ahead there, right? I mean, look at home too. I mean, all of these things are in hospitals, but there are a lot of people who give birth at home as well. Like, I mean, and obviously there are serious risks with that, right? Because there's nobody there to monitor the health of that parent, of that mother and the baby. There's just an incredible variety of things that people do. Yeah.
It's funny because my partner, his sister, when his mom's having a sister, she did it at home, water burn, had the whole pool just set up in the living room. Him and his brother were like 3 and 5 years old. And he literally was just watching Phineas and Ferb as his mom was giving birth.
Yeah. Right. Yeah. I mean, and it's what a different experience than what we just watched, right? Like, yeah, I mean, and obviously your risk of complications is much higher without physicians and things present, but people do it. People do it constantly. I mean, people give birth in cars on accident because there's no one around, like it happens. Yeah. Yeah, see, I like Ricky Bobby, right? Like it's like reminds me of like a movie, right? But it happens. It does happen. Yeah.
I've heard that it's easier to be in a squatting position when giving birth than lying down. Is that true?
Yeah, and what you often see, and you saw that with Jules, right? That she had like a bar up there. Yeah, and it gives you something to hold on to while you're pushing, right? And so sometimes, I mean, people often do a lot of that in labor, right? They'll bounce on the balls or like sit in a squatting like stance. It's difficult to maintain that, which is why they have like the bars and things. Most people do it in like a seated position, like you saw in there. Yeah, it's not impossible though. People will do that a lot to help the baby come down through the vaginal canal. Yeah. Yeah, gravity.
My question was like, how long do you like feel that it's not pain?
The intense pain,
Yeah.
right? So usually like, okay, so the first stage of labor isn't the most intense. Here's where you're having like the contractions, or just you push during the contractions, right? So I would say like 30 minutes to 2 hours. And that's where you get people screaming and like really like having a hard time. It's crazy. If you walk by a labor and delivery unit, it is a little frightening. Like you hear a lot of yelling, but it's really only that like second stage that people are feeling most of that. And a lot of people at that point have received an epidural or some kind of pain management, but it's really here that it hurts the most, right?
It kind of like, it's a little misleading because I feel like it seems like it's the whole time you're
Right. Nah, and it's not. Like I said, we cleaned the house when my partner was in labor. I mean, she's tough. Like I get a scratch and I'm done, right? Like forget it, right? I can own that. But yeah, it's usually like 30 minutes to 2 hours is the most intense part of it. Yeah, sorry, I didn't see you. A limit. I mean, people have had multiple, but I don't know if there's like a point where they cut it off. That's a bad pun, probably. Sorry. Yeah. Or. Yeah. Yeah, because the scar tissue builds up, right? And oftentimes women won't have any sensation in the area where they were cut for the C-section. It's very common that the scar in the area around it, you will never feel anything there again. And so the more that you do that, the more likely you are to have complications, but it might still be safer than trying to do a vaginal birth after multiple births. So those are things to be weighed with a doctor, right? Depending on how everything is going. Good question. Yeah, I don't know if there's a limit. It would really be like a case by case.
It would also be like based on one's age.
Yeah, for sure.
Like if you have like 4 C-sections and you're like, say like 37, 38, you're like considered high risk.
Yeah, anyone over 35. Yeah.
Yeah.
Mhm. Yeah, I mean, all of those things are taken into account, right? Typically, if you're over 35, you're considered at risk, period. And so there might be different things that are done depending on your age. Yeah.
I don't think that did it get younger in the past years. Like I swear the cutoff was like 45.
Yeah.
I remember it, and then at some point it was, and when like. When we got out on grade 5, and like they sent like my son straight to like geriatric pregnancy, like a special doctor.
Yeah.
It's gonna be very big.
I got 36. I'm not-
Not even old.
Yeah.
It like was it.
As far as I know, it's always been after 35, and that's more of like a chromosomal thing. After 35, you're at a higher risk for genetic defects, because chromosomal abnormalities. But I mean, people are having babies later and later and later. And because of all these infertility methods that we have, I mean, there are a lot of people in their like 40s and 50s having babies when that wasn't so common, go back 20, 30 years. So as far as I know, it stays pretty similar, but there's been a huge change in the range of people having babies. Like it used to be pretty uncommon to have them after like your mid 40s, and now like you'll hear people in their like 60s having babies, right? Like, which is very different. And it's usually more people who have done like IVF and maybe had their eggs frozen. And so it's not necessarily that they're actively ovulating. They might have even gone through menopause already, right? But if they had eggs frozen or like went through like an IVF cycle, it would still be possible.
Yeah, I think it's two that had their third child at 42.
Yeah.
They're both fine,
Yeah, I mean, and it doesn't mean that anything is going to go wrong. You're just at a higher.
but they were like.
It sounds so awful. You're like, I'm only 42. Yeah. Yeah. Oh, if it comes back.
Oh, okay, so you can give birth after you've had menopause, like if you froze your eggs.
Yeah.
That's
Yeah, you could still be
amazing.
pregnant. You're more likely to have complications. But yeah, you could have somebody else's eggs or your own and get pregnant. I forget what the oldest case was. It's someone in like their 80s who gave birth and went through pregnancy and everything was fine. So after you give birth, this is called the postpartum period. So we have prenatal, now we have postpartum. And this is the first few weeks after childbirth. And there's a lot of changes, right? When you give birth, all of those hormones that were in your system crash. Very common for women to have what are called the baby blues, right? So after they give birth, they're sad. There's some depression. They might cry over nothing, right? It's very common, just your hormones are all over the place, right? Versus postpartum depression is actually fairly uncommon, right? And it's much more severe. And sometimes people require treatment because they might have obsessive thoughts about hurting their baby, right? Andrea Yates, if you've ever heard of her, the one who drowned her 5 children in the bathtub because she had postpartum psychosis, right? There are cases like that where people think about hurting their baby because they have a psychosis that's present versus the baby blues, super common, right? Crying over little things because you're exhausted and your hormones are all over the place, normal, right? Postpartum depression and psychosis, not so much. Yeah.
So there's two things. The oldest people's birth.
Uh-huh.
So one that had a successful pregnancy, she gave birth at 73.
73.
She became pregnant through in vitro fertilization,
IVF.
section. That was in India, and it was actually twins.
Uh-huh.
But there's also another case from like 2009,
Okay.
where a 92-year-old.
92. Oh my gosh. That's a geriatric pregnancy. Yeah.
Inside of her, I don't.
So sometimes when people have a miscarriage, especially if it's early in the pregnancy, you might not know it, right? If you didn't know you were pregnant, you might not know that you had a miscarriage. And so there might be like a small mass of like that undeveloped embryo or fetus that's in there. And you might carry that and not know it. That's just really, really, really exceedingly unlikely, but it can happen, right? Yeah. 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 Yeah.
Sometimes she's never offended by dead baby jokes.
It's really common that they screen for this. I mean, you are monitored heavily after you give birth. You have to come in and have your baby be seen like within a couple of days. They monitor that parent, right? There's a lot of resources because postpartum depression can require like immediate treatment. I mean, your hormones are just so out of whack. There's a crash that happens when you no longer have that baby inside of you. And so the baby blues, as I said, common. Like my partner would cry over, like, couldn't find a sock and would cry for 20 minutes. And like, it's okay, I'll buy you new ones, right? It happens, right? And it's just, you're sleep deprived. When you don't sleep, your emotions are all over the place, right? Like if you're sleep deprived and haven't gotten enough rest, you add to that your hormones are all over the place. It makes it tough, right? Depending on how much support you have too, it can be even harder. Yeah.
I think the picture of it there, would they like? Oh my god, which one? Come back.
Okay. If you think of it, feel free to. Yeah.
More that you, every time you meet with the doctor, they will ask you questions about your mental state. There's actually a whole inventory that you start taking halfway through pregnancy where you rate your emotional reactions to things. And like they have social workers come in to meet with you. We talk about the resources available to you and for that continued after trouble. Do you think of it?
Yeah, they could get in trouble, huh? They would get in trouble for like, if they were to ever hurt the baby.
Oh, for sure.
Which is kind of sad though, because it's like they're not really thinking straight.
Right. Like Andrea Yates, because I teach abnormal psychology, we talk about her in the last unit. She was found not guilty by reason of insanity because her mental illness was so intense that she was considered insane at the time. But you could obviously, if you commit, I mean, that's still murder.
Yeah.
She lived in a psychiatric hospital for years.
So it stayed after too, like did she still have like?
Yeah, and it got worse for her specifically. She's like a very intense example, but she had 5 children, and with each one, it got worse every time. Children, and her husband had them anyway, and she believed that God told her that she needed to kill the children because psychosis means like schizophrenia cannot, like a full-blown depressive episode, can't shake it. They might require medication or treatment. Hers is an extreme example, but it happens. It happens very rarely.
It's crazy because this would never have done that before probably. It's wild.
Yeah.
So like you said, they start screening you for full-blown depression and after.
Sure.
What do they do if you show like symptoms or success that
Yeah.
you give birth?
They connect you to social workers and therapists.
Okay.
So they might get you into therapy and into support
When you give birth?
before you get birth, and then you would continue it after. So like it's something that is very like well known and documented, and so they usually start screening for around 5 to 6 months in a pregnancy. And then if you show flags, they will connect you to somebody so that you have the help already established before you've given birth,
Yeah,
because it's only going to likely get worse out.
gotcha.
Yes.
Uh-huh.
Kind of building off that, if it does get worse, will they take the kid away until you've shown signs of improvement?
What they are more likely to do is put you in like a intern, like an inpatient hospital setting where you would be able to be with your baby, but be monitored at the time. Like, and that's if it's very severe, right? And if there's a partner, right, that's okay and involved, right, it might be more like, working with the family unit. But in very severe cases, they might like hospitalize you where you are still with your baby because it's usually considered the best thing, but monitored at the same time, right? That's in like a severe case. Usually it's medication or therapy and people are typically okay. It can pass pretty quickly, right? It could be something that's only a few days or weeks. And then as everything kind of goes back to normal, it disappears for most. What was that? Oh, for sure. And most of the time it goes away on its own, right? With Yates that we've been talking about, because she had so many children, it got worse every time. She had a history of really bad depression before she gave birth, right? So she was a red flag already, but because they were so religious, they refused to care. And that only compounded. Yeah.
Would they also try to give you like hormonal treatment since that's like the cause of it? 'Cause I know my mom was postpartum.
Yeah.
Her hormones just crashed and it happened after menopause too. She got, when I was born, she never got her period back. And then she didn't actually go through menopause till later, but she had to wear like estrogen patches and stuff.
Yeah, that might be a possible treatment as well, like hormonal treatment and antidepressants. It depends, right, on what's going on. But yeah, I mean, keeping for sure.
Would antidepressants be just to use if you're not breastfeeding?
Yes, so if you are breastfeeding and taking antidepressants, you might have a bottle. Right, and so depending on the antidepressant, some are more risky than others. It might be that you have to bottle feed or formula feed, because that antidepressant could go to the baby. Yeah, what you eat after you give birth matters just as much if you're breastfeeding. If not, then it doesn't matter. But if you're breastfeeding, it's still going directed to that baby. So, speaking of, could have paid you for the transition to breastfeeding, right? That's another big thing that people have to decide right off the bat. Am I going to breastfeed or bottle feed? Interestingly, it doesn't have to be one or the other. You can do both, right? A lot of people do both because there are advantages and disadvantages to both. Now, breastfeeding, there are some serious advantages. It's free, okay? Formula is expensive, right? And we had that massive formula shortage, like what, last year or whenever it was. Formula went so high that people oftentimes had to like scramble for other alternatives. I mean, a baby will go through a canister of formula in a couple of days. Canisters are like $20 to $30 for the basic formula. Some babies require a more advanced one. So formula is expensive. Breastfeeding, free, right? Yeah. Yeah, and some people can't. Yeah, some people are unable to. Oh, see, and sometimes you can do it anyway. It's not always possible, but most of the time it is. Your body, because of everything going on, it produces a lot of hormones like prolactin that stimulate the production of milk. Yeah.
Like,
Yep.
get the breast milk
Yep.
and put it in a bottle because like,
Yeah.
I heard babies take this off and I'm not doing.
You're not gonna bite them up. They don't have teeth. They don't have teeth yet. They can't. They have gums, but no teeth. Babies are born without teeth. So I won't say that it doesn't hurt. They have a powerful like sucking power. If you ever have a baby, like you can put your finger near their mouth, they will like bite and like gnaw on it a little bit and suck on it. It's a very powerful natural reflex. And so breastfeeding can be painful, right? Your breasts are tender naturally, right? And then you add the hormones and you add the fact that you just gave birth and then you add a baby sucking on them multiple times a day. It can be very painful for people, but it's also a very wonderful like bonding opportunity with the baby, right? And breast milk has a lot of positive qualities to it. It reduces the risk of something called SIDS, sudden infant death syndrome, which is completely unexplained. There's this phenomenon where babies in the first year of life can just suddenly die in their sleep. Right. There are a lot of correlations to how you put them in the crib, right? They need to sleep on their back. When babies are sleeping on their stomach, it's like they're not able to get enough air and they can actually like die, right? It's terrifying. It goes away after the first year, but it's something that can happen in rare cases. It reduces the risks of that drastically. It also regulates the baby out. You pass a lot of your antibodies onto that baby, reduces their likelihood of things like diabetes and all sorts of other stuff. On top of that, as I mentioned, it doesn't cost anything, which is a huge advantage. A lot of people will pump, right? So we had twins, like you can't breastfeed. Well, I won't say you can't. It's difficult to breastfeed two babies at the same time. There are special pillows for it that you can have. Like we had one where like two little spots, right? It's crazy. But if you pump, you could buy a breast pump. And what that allows you to do is pump that breast milk out, and then you could feed it to the babies in a bottle, but it's still breast milk. Right? What other people will do is use formula. So formula has a lot of vitamins and nutrients that aren't found in breast milk. So what some people will do is breastfeed and formula, and you get the best of both worlds. And sometimes women don't produce enough breast milk to feed a baby. At the very least, it's like the American Pediatric Association. They want you to breastfeed for at least a year, right? Ideally up to 2 years. But a year is like the minimum they recommend. And so oftentimes people will do a little bit of both as they transition away. And sometimes women will stop producing milk. The more you feed a baby, the more milk you produce. It's like a supply and demand thing. But sometimes it can kind of taper off, especially if you're not drinking enough like water, keep hydrated. Yeah. Yeah. No, I think you just you get used to it, right? You're like, I'm just not doing this, right? I mean, you definitely get used to it, right? I mean, you're feeding a baby like 8 to 10 times a day or more. They can only eat so much. Their stomach is so tiny in the beginning.
right? But at the very least, at the very beginning, there's something that we call like liquid gold called colostrum. Lovingly called liquid gold. Right, it's the first like few times that you feed a baby has the most nutrients, the most beneficial stuff in it. At the very least, hospitals will encourage you to at least feed them for a week, right? And then if you move on after that, you move on. But traditionally, it's encouraged for at least a year. But at the bare minimum, that colostrum plays a really big role. It's also a natural laxative for the baby. It takes the baby a few days for them to have like their first bowel movement, which are black, by the way. It's so strange. But when you breastfeed them, it happens a little faster if it stays moving.
I don't know where this, is it true that it's not is the
I don't think it tastes very sour, right? So if anything, it's super sour. You know, and I think it tastes different from woman to woman depending on the things that they're consuming. But yeah, I mean, I out of curiosity was like, okay, I have to see what this tastes like. Right, not on tap, right? Yeah. Thanks for that.
No, if anything, it's like very sour, but breast milk contains a lot of things that could be dangerous, right? So we'll talk about STIs in our next unit. All STIs can be passed through breast milk. Okay, so if a woman has certain STIs, especially things like AIDS or HIV, that will go through breast milk. So people sometimes sell breast milk, right? They'll pump and sell it for people to purchase who can't do it on their own. Very dangerous, right? Because anything that they possess could, in theory, be transferred through the breast milk. So you want to be careful of it. I mean, it won't harm you if you like try it and the person doesn't have any like diseases or anything like that. It doesn't taste like regular milk. It doesn't taste good. It's kind of sour. I mean, babies could, right? But I'm not sure they have much of a choice.
Yeah.
Yeah.
Like you're eating. Thinking of the most nature, like the baby needs as nutrients and produce them.
I'm not sure how you do that.
Like,
It's like this.
it'll like kind of like know what the baby needs.
Okay,
So,
gotcha, yeah. It's similar, we were talking about this after last time, sometimes women have all sorts of cravings during pregnancy and during breastfeeding. I mean, part of that is almost like your body telling you, hey, you need these things in order to balance what's going on in your system. Sometimes they're random, and sometimes they can even be non-food items that women will crave because they need certain vitamins that they're deficient on. But yeah, every woman creates and produces different breast milk that is thought to be kind of catered to their child versus formula is very like, you know, one-dimensional for everybody. But it's pretty common for people to do both, right? Last thing of your sex after birth, right? Traditionally, as soon as your body has recovered, you are allowed to resume having like sex like normal. This on average takes like 6 to 8 weeks for your uterus to go back to its normal size, your vaginal wall to go back to its normal size, your cervix to go back. As soon as someone is no longer bleeding or no longer in pain, they can typically go back to sexual activity. Not uncommon for women to bleed for a few weeks after they give birth. Just residual like mass from the uterus will come out, almost like a heavy menstrual cycle at times. But as soon as like a woman has recovered, they can typically go right back to this. So again, some advantages and disadvantages. Really, obviously, like a lot of things to weigh. And typically, you would have these conversations in those childbirth classes that you have ahead of time, where they'll go over all the options. Most hospitals push very heavily for breastfeeding. I mean, almost shamefully so. Like there's a lot of shaming for people who can't do this or don't want to do this. But it is ultimately a choice that you have after you give birth. Okay. All right. So obviously we're kind of out of time. We're at the end. What we'll do on Monday. So Monday we have we should have a guest speaker if everything goes smoothly coming in to talk about STIs. Look forward to that. And then we'll be building on that afterwards. So have a wonderful weekend. I'll see you all on Monday. Close this.